Blood products are natural components of blood that can be transfused as adjuncts or replacement therapy. They can be used in conditions that increase the risk of bleeding, like thrombocytopenia, platelet dysfunction, or clotting factor deficiencies, as well as symptomatic anemia, and for hypovolemic shock that is secondary to trauma or severe bleeding. Now, there are different types of blood products depending on what they contain. Whole blood contains red blood cells, white blood cells, platelets, and plasma. On the other hand, some clients may be transfused with specific blood components. This includes packed red blood cells, or PRBCs for short, which are red blood cells that have been almost completely separated from platelets and plasma, as well as platelet transfusions and fresh frozen plasma. In addition, specific components can be extracted from plasma, such as albumin, as well as cryoprecipitate, a blood product that contains clotting factors. Now, the blood for these blood products can be taken from clients themselves or from a different person. In autologous transfusion, the blood is taken from the client before a scheduled procedure so that their own blood is reinfused later on. A specific type of autologous transfusion is called intraoperative blood salvage, or cell salvage, and it refers to a retrieval of blood that has been suctioned or drained during surgery from the client's body cavities, joint spaces, or other closed body sites. The blood is reused and reinjected into the client after it's been washed or filtered. Another possible blood source is allogenic transfusion, in which case the blood is derived from a compatible donor in terms of ABO and RHD blood group. Now, all blood products are administered through an intravenous transfusion and work by replacing the blood components that are missing or dysfunctional. Whole blood transfusions replace all blood components, so they're indicated to restore severe blood loss. Packed red blood cells replace erythrocytes to restore the oxygen-carrying capacity as well as the blood loss, while platelet transfusions help restore the adequate number of functional platelets needed for hemostasis. Cryoprecipitate and fresh frozen plasma are also important for coagulation and hemostasis, since they help restore the clotting factors. Cryoprecipitate is particularly useful in restoring factors 8 and 13 and von Willebrand factor, as well as factor 1, or fibrinogen, while plasma administration also helps increase the intravascular volume. Now, before administering blood products, it's important to know the blood type of both the donor and the recipient and check for compatibility. Now, the blood type is based on two classification systems, the ABO system and the RH system. The ABO system refers to the type of glycoproteins found on a person's red blood cells. You can have type A, type B, type A and B glycoproteins, or no glycoproteins, which is called type O blood. On the other hand, the RHD group refers to the presence or absence of the RHD antigen. So people are either Rh positive, meaning they have the antigen on their red blood cells, or they are Rh negative, meaning it's absent. So to check for blood compatibility, first the client's blood is drawn to identify their ABO and RHD blood groups, as well as screen for antibodies against A, B, and RHD antigens. Then, cross-matching is done by combining the red blood cells of a specific donor with the client's plasma or serum. If agglutination occurs, the test is considered positive and further testing may be needed, whereas no agglutination is considered negative and is usually sufficient to determine ABO and RHD compatibility. Okay, now type A clients can receive blood type A or O because they have antibodies against the B antigen, while type B clients can receive blood type B or O because they have antibodies against the A antigen. This means that type AB clients have no antibodies against either and can receive any type of blood, while type O clients have antibodies against both and can only receive type O. On the other hand, clients that are RHD positive can receive both RHD negative or positive blood since they do not have antibodies against the RHD antigen. On the other hand, RHD negative clients can't receive RHD positive blood since they could develop a hemolytic transfusion reaction. Thus, donors with an O negative blood type are considered universal donors, while AB positive clients are considered universal recipients. Although blood products have very important indications, there are many possible side effects, including transfusion reactions, which can be life-threatening. One of the most dangerous transfusion reactions is transfusion-associated circulatory overload, referring to a form of pulmonary edema occurring when clients get large product volumes in a short time, as well as transfusion-related acute lung injury, which can lead to fever, chills, and respiratory distress. Another dangerous reaction is acute hemolytic transfusion reaction, which usually occurs when a blood product is given to an incompatible client and manifests as fever, chills, flank pain, leakage from the site of injection, and decreased hematocrit. Then there's also sepsis, which occurs when the transfused product contains a pathogenic microorganism causing fever, chills, and hypotension, and anaphylactic transfusion reactions, which include allergic reactions like angioedema, wheezing, and/or hypotension. IgA deficient clients are at a particularly higher risk for this last complication since they have anti-IgA antibodies. Blood products can also cause an urticarial transfusion reaction, referring to hives with no allergic findings. Febrile non-hemolytic transfusion reactions, manifesting as generalized fever, sometimes with chills, but no other systemic symptoms. And lastly, primary hypotensive reactions, which is a sudden drop in blood pressure that's caused by the transfusion and returns to normal or baseline when the transfusion is stopped. It mostly occurs during platelet transfusions. Other possible side effects of blood products include diseases transmitted from the donor, such as HIV or hepatitis viruses, as well as bacterial contamination. In addition, citrate toxicity or electrolyte imbalances, such as hyperkalemia and hypocalcemia, can occur. Citrate toxicity manifests as myocardial depression and coagulopathy. Hyperkalemia can cause weakness, diarrhea, and dysrhythmias, and hypocalcemia can lead to muscle cramps, paresthesias, or hyperactive reflexes. Finally, some clients, especially those getting transfusion of multiple units of blood, can develop iron overload. Okay, now it's important to remember that blood products are contraindicated when there's ABO or RHD group incompatibility. RHD compatibility is mainly important when receiving red blood cells and platelet units, while it does not apply to acellular components like plasma and cryoprecipitate. Therefore, RHD negative clients should only receive blood cells and platelet units from other RHD negative donors, while RHD positive clients can receive them from both RHD negative and positive donors. Additionally, you should not transfuse a blood unit that's been taken from the storage bank more than 4 hours earlier, as room temperature can damage the blood components and increase the risk of bacterial proliferation. Moreover, blood product transfusion is contraindicated in clients at risk of fluid overload, such as those with certain cardiovascular or hematologic conditions. Finally, special attention should be given when clients have religious or cultural objections to receiving blood products. All right, when caring for a client prescribed packed red blood cells to treat post-hemorrhagic hypovolemia and anemia, first perform a baseline assessment by checking their history of previous blood transfusions, including transfusion reactions, and take note of their current symptoms, including fatigue, weakness, or shortness of breath. Be sure to ask about cultural or religious beliefs regarding blood transfusions. Take a set of pre-transfusion vital signs, noting presence of fever as well as signs of decreased cardiac output and ineffective peripheral tissue perfusion, including tachycardia, hypotension, and tachypnea. Then review recent laboratory test results, including type and cross-match, CBC, platelets, hemoglobin, hematocrit, potassium, calcium, and iron. Lastly, verify the order for packed red blood cells and confirm that informed consent has been obtained. Now, let's move on to client education. Explain to your client that the blood product will help restore their blood volume and increase their blood's ability to carry oxygen. Also, let them know the transfusion will last 2 to 4 hours and that you'll be monitoring them closely for the development of any side effects. All right, when preparing to administer packed red blood cells, ensure your client has a patent 18-gauge peripheral IV in place and that normal saline is infusing through a Y-type blood administration set with an inline filter. Then, administer any ordered pre-transfusion medications like acetaminophen and diphenhydramine. When the blood product arrives from the blood bank, follow your facility's policy by working with a second nurse to confirm your client's identity and verify the information on the healthcare provider's order, transfusion record, blood product, and medication administration record. Next, be sure to start the transfusion within 30 minutes of receiving the blood product from the blood bank. Begin infusing the blood slowly, about 2 milliliters per minute, and stay with the client for the first 15 minutes. After 15 minutes, take a second set of vital signs and assess for indications of a transfusion reaction. These can include shortness of breath, wheezing, fever, chills, flank pain, rapid thready pulse or hypotension, as well as angioedema and hives. If there are no signs of a transfusion reaction, confirm the infusion rate and input the correct milliliters per hour into the infusion pump. During the transfusion, continue to monitor your client closely and assess their vital signs every 30 minutes, and then at 1 hour after transfusion is complete, or per facility protocol. Now, if an acute hemolytic transfusion reaction is suspected, immediately stop the transfusion and remove the blood product and tubing. Then, use new IV tubing to infuse normal saline at a keep vein open rate, and notify the healthcare provider and blood bank. Continue to monitor vital signs every 15 minutes and be prepared to administer emergency medications as ordered. Insert an indwelling urinary catheter, closely monitor their intake and output, and send urine specimens to the laboratory along with the blood product and tubing. After the transfusion is complete, teach your client about side effects that can occur even days after treatment. Emphasize the importance of immediately seeking medical attention if they notice signs and symptoms that may indicate delayed transfusion reaction, including a skin rash, hives, trouble breathing or swallowing, fever, severe fatigue or weakness, as well as symptoms of an electrolyte imbalance like diarrhea, muscle cramps, twitches, or spasms, and tingling in the hands and feet. Lastly, let your client know that they should avoid vaccines for 3 months after their transfusion in order to avoid an immune reaction. Finally, while caring for a client receiving a blood product like packed red blood cells, closely monitor your client's CBC, hemoglobin, hematocrit, fluid status, vital signs, and for the development of side effects that can occur during and after the transfusion. Be sure to evaluate for the desired therapeutic effects of the transfusion, including the restoration of blood volume, improved capillary refill, and an absence of the symptoms of anemia. All right, as a quick recap, blood products are naturally made by the human body and are transfused when the blood components are deficient or not functioning properly. Whole blood can be transfused or specific components, including PRBCs, platelets, fresh frozen plasma, albumin, or cryoprecipitate, and these can be administered to target the client's unique needs. Blood products are obtained either from the client themselves, which is referred to as autologous transfusion, or from a donor, known as allogenic transfusion. Side effects can occur when administering blood products and include acute or delayed transfusion reactions, fluid overload, septicemia, iron overload, disease transmission, hypocalcemia, hyperkalemia, and citrate toxicity. Blood products are contraindicated when there's ABO or RH incompatibility between the donor and client, the blood product has been at room temperature for more than 4 hours, there is a risk for fluid overload, or the client has religious or cultural objections to blood transfusions. When caring for a client receiving a blood product, nursing considerations include performing a baseline assessment, monitoring for side effects and responding to transfusion reactions, evaluating for the therapeutic response, as well as providing education about what to expect during treatment.
Helping current and future clinicians focus, learn, retain, and thrive. Learn more